60 years since the start of Medicaid in the United States. But Governor Walz and other leading Democrats say the recent law signed by President Trump will undermine the program. Danny Spiewak joins us live from the Capitol now with more on what the governor said today. Danny?
Well, for months, Governor Walz, both here at the Capitol and his national town hall tours, he's really criticized Republicans for the bill known as the One Big Beautiful Bill. Walz and the state have argued that thousands in Minnesota could lose Medicaid coverage and access because of that law. And today, Governor Walz took that message and carried it again at a stop in Maplewood at an MHealth Fairview facility.
60 years ago Wednesday, LBJ signed the law that established Medicaid for low-income Americans.
An incredibly visionary piece.
But during a visit to MHealth Fairview St. John's Hospital in Maplewood, Walz described a looming emergency for Medicaid because of the law signed this month by President Trump.
What are the positives of this? Because if the argument is this was about saving money and reducing the national debt, it did not do that.
According to the Minnesota Department of Human Services, as many as 140,000 people in Minnesota could lose Medicaid coverage under the law. The Walz administration argues new work requirements and more frequent eligibility checks will make it harder for people to access the program. MHealth Fairview CEO James Hereford says fewer people on Medicaid means more pressure on the system when people show up to the hospital without insurance.
Healthcare financing is a Jenga tower. And what we're doing is we're taking pieces out. And at some point, this is all going to collapse.
Republicans in Congress, like Minnesota Representative Tom Emmer, see things differently.
Lies, deception, fear-mongering.
Republicans dispute the notion that their law cuts Medicaid, instead portraying the new work requirements as needed welfare reform.
Republicans on the Energy and Commerce Committee have laid out a clear path to strengthen, secure, and sustain the program for those who need it the most.
Still, Minnesota estimates the new law will cost the state more than $1 billion in funding over the next 4 years.
I'm at the point right now, they can't balance budgets. They run up the national debt. Leave us our federal monies.
During the legislative session this year, we often heard the governor say that he would consider calling lawmakers back in the fall, come back to the Capitol to deal with adjustments at the state level due to any legislation passed by Congress. But now it appears unlikely that will happen. We will probably just see legislators back again in February for the start of the 2026 session. Back to you.
All right, Danny, thank you.